Okay, let's unpack this. Here's a stat that might make you do a double take. Roughly 20% of adults in treatment for, addiction also have ADHD.
Wow.
Yeah, that's a really significant overlap, isn't it? And it suggests these two things are, well, more connected than maybe many people realize.
That's fascinating, the sheer co-occurrence there. When we see ADHD and substance use disorders or SUDs happening together so often, it really points towards maybe a shared vulnerability or even a cycle where one condition can make the other worse.
Exactly. And you're tuning in, probably like us, because you want to get to the heart of the matter, quickly and thoroughly. So this deep dive, that's exactly what we aim to do.
Mm-hmm.
We've got a range of insights today. We're looking at articles from the European Addiction Research Journal, current psychiatry reports, and also an advisory from SAM-HSE, so bringing together both scientific findings and clinical perspectives.
Right. And if we sort of frame this, our aim really is to explore this relationship
Yeah.
between ADHD and SUDs. We want to understand what the science is telling us about why they often show up together, what that means for people, and maybe most importantly, what we know about treatment and maybe even prevention strategies.
Yeah, hopefully getting some clarity and maybe some aha moments along the way.
Hopefully.
So let's start by just looking at how common these conditions are on their own. I mean, both ADHD and SUDs are pretty prevalent mental health challenges, right?
They really are. If we look at the general population, ADHD affects something like 6% of kids and adolescents. And, there was a time people thought it was just a childhood thing, but we now know about 2.5% of adults also have ADHD.
Okay, and here's where it gets really interesting, I think. Research consistently shows that if you have ADHD, you are significantly more likely, we're talking about 2 to 3 times more likely to develop a substance use disorder
Yeah.
involving things like, nicotine, alcohol, marijuana, cocaine, or other substances.
That just raises such an important point about how often they coincide. Like we said at the start, if you look specifically at adults already getting treatment for an SUD, that rate of co-occurring ADHD just shoots up to around 20%.
20%. Wow.
It really underscores how vital it is to think about underlying ADHD when you're treating addiction.
So it's not just that they happen together, is it? It sounds like the actual sort of timeline and the impact are different when both are present.
Precisely. That's what the studies indicate. Individuals who have both an SUD and ADHD, they tend to start using substances at an earlier age.
Younger. Okay.
Yeah, younger. And they also seem to progress to a full-blown SUD more quickly, faster.
And unfortunately, it sounds like the difficulties don't stop there. I mean, relapse is a huge challenge in addiction recovery anyways, right? But it seems like it's an even bigger hurdle for those who also have ADHD.
The data definitely supports that. SUD patients who also have ADHD face, a higher risk of relapse. We also see signs of increased severity in their substance use, including smoking. And they often experience greater functional impairment, just more difficulty in their daily lives. Their substance use pattern tends to be more severe overall.
That paints a really, really challenging picture. And it's even more concerning, frankly, to learn about the potential for an increased risk of attempted suicide in people dealing with both SUDs and ADHD.
Yeah, these are significant consequences. It really highlights the critical need to understand this comorbidity, having both conditions better, and, develop effective ways to help people.
Okay, so the massive question then is why? Why is this connection so strong? What are the underlying factors making ADHD and SUDs so likely to occur together?
Well, there are several ideas, and they're probably interconnected. One really prominent theory is what we call the self-medication hypothesis.
Self-medication, okay.
The thinking here is that individuals with ADHD might turn to substances as a way to try and manage their ADHD symptoms, like inattention, impulsivity, or maybe just cope with the negative feelings that can sometimes go along with the disorder.
Ah, okay. So it's not just about chasing a high, maybe,
Yeah.
but trying to sort of level things out or reduce the struggle.
Exactly. Almost like an unintended and ultimately harmful form of therapy for those underlying difficulties with focus or maybe emotional regulation.
That makes a lot of sense, actually.
Yeah.
I can totally see how someone struggling to concentrate or feeling constantly restless might reach for something that gives them a sense of calm or focus, even if it's only temporary and, damaging in the long run.
We even see hints of this with nicotine. Some adults who are dependent on nicotine actually report that it helps improve their attention and executive functioning, those sort of higher level thinking skills.
Really, with nicotine?
Yeah, which fits right into that self-medication idea.
Okay, so beyond trying to self-medicate, are there, actual biological factors at play? things in the brain contributing to this link.
Absolutely. Neurobiological research has pointed to potential structural differences in the brains of people with ADHD.
Like that.
Well, for example, some studies suggest smaller volumes in areas like the frontal cortex, that's kind of the brain's CEO, right? Responsible for planning, decision making.
Right, the executive functions.
Exactly. And also potentially smaller volumes in the cerebellum and some subcortical structures. And functional imaging studies looking at brain activity also suggest differences, particularly deficits in areas involved in attention and impulse control, like the anterior cingulate.
So it's not just about behavior. There might be actual sort of fundamental differences in brain structure and function that increase vulnerability.
That's the idea. And what's more, studies looking at twins and also these big genome-wide association studies, they've identified shared genetic risk factors.
Share genes for both.
Yeah, shared genetic risk factors for both ADHD and SUDs, which suggests that some individuals might just be wired, you could say, in a way that predisposes them to challenges in both attention and impulse control, making them more susceptible to both conditions.
That's fascinating. It's like a shared genetic blueprint, potentially increasing the odds for both.
And then we also have to consider the role of the brain's reward system.
Uh-huh.
It's thought that individuals with ADHD might have what some researchers call an impaired or maybe differently tuned reward system. This could make substances which, powerfully activate these reward pathways particularly appealing, more reinforcing.
Ah, so that instant gratification, that dopamine hit, it might be even more intensely felt or maybe more sought after by someone with ADHD.
Precisely. That's one line of thinking. Now, it's also important to acknowledge the connection to what we call externalizing behaviors, things like conduct disorder.
Right.
But the research also clearly shows a significant independent link between ADHD and SUDs, meaning the connection isn't solely explained away by these other co-occurring issues. There's something specific between ADHD and SUDs.
Okay, that's an important distinction. It really sounds like a complex mix of factors. What about environmental stuff, like family history or things that happened before birth?
Yeah, those are definitely important considerations too. A family history of SUD, especially in parents, can certainly increase risk. That's likely a mix of genetics being passed down and also the environment within the family.
Sure, nature and nurture.
Right. And additionally, exposure to substances like nicotine or alcohol during pregnancy gestational exposure, that's been pretty consistently linked to a higher risk for ADHD in the child later on.
Okay. This paints a really comprehensive, if slightly worrying, picture of all the vulnerabilities involved. Now, let's tackle a really crucial question. I'm sure this is on a lot of people's minds. Does treating ADHD with medication actually increase the risk of someone developing an SUD later?
Right. This has been a huge concern historically, hasn't it? But the current weight of evidence strongly suggests that ADHD pharmacotherapy, so medication treatment, does not increase the risk for SUD.
Okay, that's huge. So it doesn't increase the risk.
No. And in fact, some research actually points the other way.
Really? How so?
Well, one big meta-analysis pooling data from lots of studies actually found that stimulant treatment for ADHD significantly reduced later substance problems. Reduced. And this effect was particularly noticeable in adolescents. And then there are other studies suggesting that starting stimulant treatment early, in childhood for ADHD, might even act as a preventative factor against developing an SUD down the line.
Wow. So far from being a gateway to substance abuse, it might actually be protective in some cases.
That's the implication, yes, that we're seeing in quite a bit of the research. We also have findings indicating that using medication to treat the ADHD can lead to better outcomes in people who are already struggling with both an SUD and ADHD.
How does that work?
Well, there was one interesting study, for example, looking at incarcerated men. They had both ADHD and amphetamine dependence. They found that treating them with methylphenidate, a common ADHD stimulant.
Like Ritalin?
Exactly. It not only reduced their ADHD symptoms, but it also led to a significantly higher proportion of drug-negative urine screens.
Okay, that's a really powerful example, isn't it? Treating the ADHD seemed to directly help with the substance use in that case.
It did in that study. Now, it's important to mention a caveat, though.
Yeah.
Some research hints that the way the brain responds to stimulants might actually be a bit different in individuals who have both ADHD and an SUD.
Different how?
It could potentially mean that higher doses of medication might be needed in some specific cases to get the same therapeutic benefit for their ADHD symptoms compared to someone with just ADHD.
Ah, okay. So it's not necessarily a simple one-size-fits-all approach. Careful monitoring by a doctor is probably always essential, right?
Absolutely critical, yes. So while the findings on, say, risk reduction aren't perfectly consistent across every single study out there, the overall consensus leans towards early treatment with ADHD medication not increasing SUD risk later on.
Right.
And there's definitely growing evidence suggesting it might even offer some protection, especially if that treatment is continued consistently over time.
This is such important information to get out there. Okay, let's shift gears then. What happens when someone is already facing the challenge of having both ADHD and a substance use disorder? What do we know about the most effective ways to treat these co-occurring conditions?
Right. Well, the very first absolutely critical step is a really comprehensive diagnostic evaluation.
Okay, why so critical?
Because active substance use itself can actually make ADHD symptoms look worse than they are, or even mimic them entirely.
Ah, I see.
So it might actually be necessary to have a period of maybe brief abstinence or at least a significant reduction in substance use just to get a clearer picture, to arrive at an accurate ADHD diagnosis separate from the substance
That
effects.
makes perfect sense. You need to untangle what's causing what symptom advance.
Exactly. Then, when we look at treatment approaches, psychotherapy seems to play a really significant role. Structured therapies like cognitive behavioral therapy, CBT, and also motivational interviewing, MI, they've shown quite a bit of promise, especially in treating adolescents and young adults dealing with both ADHD and an SUD.
Okay, so it's not just about pills. These talking therapies, these behavioral therapies are crucial too.
Indeed. And some research has shown that individuals who get CBT or MI in addition to medication often see overall improvements in both their ADHD symptoms and their SUD symptoms.
So the combination is helpful.
It seems to be. And interestingly, this improvement can happen even in studies where the medication alone didn't show significant differences between the treatment group and maybe a placebo group. It really suggests that the psychotherapy component might be a really vital ingredient for success here.
That's really encouraging to hear about the therapy side. But what about using psychotherapy just on its own, without meds? Is that known to be effective for this specific combination?
That's a good question. The research that specifically looks at psychotherapy as a standalone treatment for co-occurring ADHD and SUD, while it's still somewhat limited at this point, we definitely need more investigation to fully understand its potential effectiveness all by itself.
Okay. And what about the role of medication when someone is actively using substances? You mentioned meds can help ADHD symptoms, but what about the addiction itself?
Yeah, it's interesting. Based on current research, treatment with medication alone doesn't seem to be particularly effective in treating the substance use disorder itself in individuals with ADHD who are, currently actively using.
So taking an ADHD med while still heavily using might not curb the substance use much.
It seems not, generally speaking. While stimulant medications like methylphenidate can often help reduce the ADHD symptoms in this group, the findings on whether they positively impact the SUD itself, like reducing cravings or use those findings, are pretty inconsistent.
So it might help you focus better, perhaps, but doesn't necessarily tackle the addiction directly in the same way if you're still using.
That appears to be the trend we're seeing in the research,
Yeah.
yes. And, while there were those initial concerns about the potential for stimulant medication abuse in this population.
Right, giving stimulants to someone with an addiction history.
Exactly. It doesn't actually appear to be significantly higher compared to individuals who just have ADHD alone. Although it's worth remembering that the controlled environments of many research studies might influence those findings a bit. Real world could be different.
Sure, that makes sense. And what about the non-stimulant medications for ADHD? Things like atomoxetine. How do they fare in this context?
Studies looking at non-stimulants like atomoxetine, they've shown pretty mixed results when it comes to reducing both ADHD symptoms and substance use in people with both conditions. So again, there isn't really a clear-cut answer on their effectiveness in this specific complex situation just yet.
Gosh, it really sounds like this is a super complex area and maybe one where more research is definitely needed to develop really clear, specific treatment guidelines.
That's absolutely right. Currently, because the research is somewhat limited and sometimes the findings are inconsistent or even contradictory, well, there aren't specific, widely agreed upon evidence-based guidelines that we can point to for treating co-occurring ADHD and SEDs.
So what do clinicians do now?
Well, when we're talking specifically about addiction to prescription stimulants themselves.
Right, like Adderall or Ritalin abuse.
Exactly. Treatment for that often follows similar approaches to those used for other stimulant addictions, like cocaine or methamphetamine. It primarily focuses on behavioral therapies like CBT again, and also something called contingency management.
Contingency management, what's that?
That basically uses rewards like vouchers or privileges to encourage positive behavior changes, like staying abstinent from drugs.
Okay, so using established addiction treatment methods.
Yes. And another really crucial point to consider clinically is that initially getting some level of control over the addiction, whether that means aiming for complete abstinence or maybe using harm reduction strategies to lessen the negative consequences.
Right.
That might actually create a more stable foundation before really diving heavily into the ADHD treatment itself.
Ah, okay. So maybe prioritize tackling the addiction first, or at least getting it somewhat under control might be a key first step in many cases. Makes sense. Finally, let's just touch on the really important topic of preventing prescription stimulant abuse, especially given the concerns around misuse, particularly, say, on college campuses.
Yeah, this is a really important area. One strategy on the prescribing side is using extended release formulations of stimulant medications,
Why those?
because they generally have a lower potential for abuse compared to the immediate release versions. The medication is released more slowly over time, which makes it harder to misuse by, say, crushing and snorting to get a quick high.
Okay, that makes sense. Slower onset, less rush.
Exactly. Also, simply considering non-stimulant medications like atomoxetine as an alternative treatment for ADHD when it's clinically appropriate for that individual is another potential preventive measure.
What about bigger picture strategies, like on those college campuses you mentioned, where misuse for studying, etc., can be a real issue?
Yeah, proposed strategies there often include things like comprehensive education for students, making sure they understand the potential harms and risks associated with misusing stimulants.
Because some might think they're harmless, steady drugs.
Exactly. There's often a significant misconception among some students that these drugs are basically harmless, especially when they're just using them for academic enhancement, not to get high. Providing better academic support services could also help, potentially reducing the perceived need for students to resort to stimulants to cope with pressure.
Right. Tackling the root cause of the pressure.
And of course, implementing tighter controls and better monitoring of prescription stimulants to try and prevent them from being diverted or misused is another key approach.
It definitely sounds like addressing both the individual factors, like prescribing practices, and the broader environmental context, like campus culture and support, is crucial.
Indeed. And it's also worth noting, just as a detail, that surveys tend to show that medications containing dextroamphetamine and amphetamine like Adderall tend to be misused a bit more frequently than those based on methylphenidate, like Ritalin or Concerta.
Oh, interesting. So even among stimulants, there might be slight differences in misuse potential or preference.
Seems that way, yeah. Different drugs, slightly different effects and appeal, perhaps.
Okay, let's try and bring all this together then. After covering all that ground, what would you say are the most important sort of key takeaways from our deep dive into ADHD and substance use disorders?
Well, I think first is just the really significant reality of how often ADHD and SUDs occur together. It highlights a connection that we really can't afford to ignore.
Yeah, that 20% figure sticks with you.
Definitely. We've also explored the multiple reasons that likely contribute to this link, everything from individuals maybe self-medicating their ADHD symptoms to these potential shared vulnerabilities in neurobiology and even genetics. Then there's the role of ADHD medication, which is complex, but encouragingly, the bulk of the evidence suggests it doesn't seem to increase the risk of SUD, and it might even offer some protective benefits, which is huge.
Definitely reassuring.
And when it comes to treatment for people with both conditions, structured psychotherapies like CBT and MI, they show a lot of promise, often when used alongside medication. Although we have to acknowledge that specific guidelines for treating these co-occurring conditions are still sort of evolving as the research continues.
Right, more work needed there. So for you, the listener, who was maybe looking for a quick but thorough understanding, hopefully this deep dive has given you a pretty solid foundation on what is clearly a really significant issue.
And maybe this leads to a sort of thought-provoking final point. Considering how deeply intertwined ADHD and addiction really appear to be, how might truly integrated treatment approaches, those that address both conditions simultaneously in a holistic way, how might those really revolutionize the outcomes for individuals who are struggling with both?
That's a really powerful question to ponder, isn't it? If you are interested in exploring this topic further based on what we've talked about, we'd encourage you to maybe look into the work of the International Collaboration on ADHD and Substance Abuse. They're known as ICASA. Or Perhaps check out the resources that were mentioned in that same HS advisory we drew from.
Yeah, there's always more to learn, isn't there? And gaining a deeper understanding of this complex relationship is just such a crucial step towards providing better support and ultimately more effective treatment for everyone who's affected.
Absolutely. Well, thank you for taking this deep dive with us today. We really hope it's provided you with some valuable insights.